Hello everyone, my name is J.adaemma, and this presentation discusses my analysis of the Panther Canyon Community Hospital case. Throughout this project, I evaluated 16 different management and financial topics related to the hospital's operation. These topics include staffing issues, financial performance, compliance risks, reimbursement models, and strategic planning. The goal of the analysis was to identify key challenges facing Panther Canyon Community Hospital and provide recommendations to improve financial stability and care. Panther Canyon Community Hospital is a nonprofit healthcare organization that serves its local community. Like many hospitals in the United States, it faces a number of financial and operational challenges. These challenges include rising labor costs, changes in reimbursement models, regulatory compliance requirements, and pressure to maintain high-quality patient care. The case study focuses on evaluating these issues and identifying strategies that can improve the hospital's long-term financial sustainability and operational performance. One of the first issues examined in the case studies is the challenge of nursing shortages. Hospitals across the country are experiencing difficulty recruiting and retaining qualified nurses. This often results in increased salaries, overtime costs, and competition among healthcare organizations for experienced staff. The Panther Canyon must consider both financial and non-financial strategies to retain nurses. Examples include offering competitive salaries, improving work schedules, supporting a professional development, and creating a positive work environment that encourages long-term retention. Another important area examined in the project is the hospital's organizational structure. When leadership responsibilities are unclear or based heavily on personalities, it can create communication problems and operational inefficiencies. Implementing a structured leadership model, such as a functional or service line structure, can help improve coordination across departments. A clear organizational structure allows leaders to better manage resources, make strategic decisions, and maintain accountability across the hospital. Financial analysis is an essential part of hospital management. In this project, financial ratios were used to evaluate Panther Canyon's financial health. Ratios related to liquidity, profitability, and operational efficiency help administrators understand how effectively the hospital is using its resources. The analysis suggested that the hospital must carefully monitor its financial performance and focus on improving operational efficiency in order to maintain financial stability. Because Panther Canyon Community Hospital operates as a nonprofit organization, it must comply with federal requirements related to the community benefit spending. Under Section 501, nonprofit hospitals must provide community health benefits such as charity care, community programs, and financial assistance for patients. The analysis showed that hospitals must carefully document and maintain these programs to ensure it meets federal requirements and maintain its nonprofit status. Healthcare organizations operate in a highly regulated environment, and compliance is critical. Federal laws such as Stark Law and anti-kickback statute regulate financial relationships between hospitals and physicians. These laws are designed to prevent financial incentives from influencing patient referrals. Panther Canyon must regularly review physician contracts and ensure that compensation arrangements are based on fair market value and are not tied to referral volume. One of the most serious financial issues facing Panther Canyon is its cash flow situation. Financial data showed that the hospital has limited days cash on hand, which means it has very little cash available to cover operating expenses. If revenue slows down, in fact, the hospital has struggled to meet payroll in the past. Improving revenue cycle management, speeding up insurance collections, and monitoring accounts receivable are critical steps to improving cash flow. Several projects are examining specific financial decisions facing the hospital. One example involves evaluating a new supply contract that would manage how products are delivered to the hospital. Although the new contract offered operational benefits, the analysis showed that it would increase costs unless the supplier reduced the price. This demonstrates the importance of careful financial analysis before making major purchasing or operational decisions. Another financial issue examined in the case study is the hospital's long-term debt. Panther Canyon has an opportunity to refinance an existing loan at a lower interest rate. By refinancing, the hospital can significantly reduce the interest expenses over time. This type of financial strategy can improve the hospital's long-term financial stability and free up resources that can be used to improve patient care and operations. Hospitals that received federal pandemic relief funds are now facing increased oversight from federal agencies. Programs such as Provider Relief Fund and Paycheck Protection Program helped hospitals manage financial challenges during COVID-19. However, hospitals must carefully document how these funds were used and comply with reporting requirements. Maintaining accurate financial records helps ensure that the hospital avoids penalties or repayment requirements. In conclusion, Panther Canyon Community Hospital faces several financial and operational challenges, but there are clear strategies that can improve its performance, strengthen financial management, improve the revenue cycle, maintain regulatory compliance, and make strong strategic long-term financial decisions. Will help the hospital remain financially stable. By focusing on efficiency, transparency, and patient-centered care, the hospital can continue serving its community while maintaining strong financial performance. Thank you so much for listening to my TED Talk, and I hope